Picture this. A doctor is making a life-or-death decision. They've got an AI tool that gives a risk score, but it can't explain why. It's just a number spit out of a black box. Would you want them to trust it? Today, we're going to look at a new kind of AI, one that's designed to earn that trust by actually showing its work.
And that question right there is the heart of the problem for AI in medicine. For a doctor to really rely on a prediction, especially when the stakes are so high, they need more than just a number. They have to understand the reasoning behind it.
So on one end, you've got the classic black box. It can be incredibly accurate, sure, but how it gets there is a total mystery. What we're really after is what's on the right. An AI that doesn't just give you an answer, but that actually shows you the web of connections between all the different risk factors.
A recent dissertation from the University of Edinburgh really dug into this whole issue. It focuses on two huge hurdles for any AI to be useful in a real-world hospital. First, it has to be interpretable. Doctors have to get it. And second, it has to handle the messy, incomplete patient data that is just a fact of life in healthcare.
So this research didn't just point out the problem. It actually brought a challenger into the ring. It puts a completely different kind of AI model to the test, one that was literally built from the ground up to be understandable and to deal with the chaos of real-world data.
And this challenger is called a Bayesian network. Its whole deal, its defining feature, is that instead of hiding its logic, it puts everything right out there on display for you to see.
So think of a Bayesian network, or a BN for short, as a kind of map of influence. It visually lays out all the pieces, age, symptoms, other health conditions, and then it draws lines between them, showing exactly how one thing affects another through a whole network of probabilities.
And that's what's so cool about it, right? It's totally intuitive. You can literally see a story unfold. Age influences the likelihood of other health issues, and both of those things together influence the ultimate risk. It's a narrative, not just a black box calculation.
Okay, so the first big test in the study was about building this map. And the question was, is it better to just let the AI figure out all these connections from the data on its own, or does adding a human expert's knowledge actually make the map better?
And the findings? They were crystal clear. When you use a doctor's expertise to help guide the AI, the models that come out the other side aren't just more reliable and easier to understand, they actually get more accurate. It's this amazing argument for a true partnership between humans and AI.
Which brings us to the main event, a head-to-head showdown. The study basically pitted this new Bayesian network against the reigning champion of clinical risk prediction, a model called logistic regression.
The results were fascinating. First up, dealing with missing patient data. The Bayesian network handled it like a champ. It's just part of its natural design. Logistic regression needed a whole separate process to fill in the gaps, but in the end, they both performed equally well. But when it came to just raw predictive power, logistic regression did squeak out a win, but only just.
This chart shows you just how close that race was. This is called an ROC curve, and it's a standard way to measure how good a model is at predicting things. Basically, the higher the line, the better it is. And you can see that green line for logistic regression is just a tiny bit above the others. It's better, but not by a whole lot.
So, how much better are we talking about here? Well, the difference boils down to about 1%. In terms of their performance scores, logistic regression came in at 0.77, while the Bayesian network was right on its heels at 0.76. We're talking a real photo finish.
And you can actually see their different personalities in the way they spit out their results. The Bayesian network on the left gives this more varied, almost kind of chunky set of risk probabilities. Meanwhile, the logistic regression model on the right produces this much smoother, more continuous range of scores. It's like two different prediction styles.
But here's the thing. Prediction is only half the story. The Bayesian network has a secret weapon, a superpower that a simple risk score could never match. It has the ability to ask, what if?
This is a really powerful idea called causal inference. See, because the BN is built like a map of cause and effect, you can use it to simulate doing something, like giving a patient a drug, and see what the true effect is. It helps you untangle whether two things are just randomly connected, or if one actually causes the other.
And using it is incredibly cool. First, you've got your map, built from all that data and expert knowledge. Then, you can basically play God in a simulation. You ask, what would happen if we gave this group of patients a vaccine? And then, the model measures the ripple effect, showing you the direct impact on the outcome.
And the study did exactly that, to figure out the effect of vaccination on COVID-19 patients.
By running the simulation, the model calculated that getting vaccinated had a direct causal effect. It actually reduced the probability of dying in the hospital by about 4.5%. That's not just a correlation, that's an estimated causal impact.
So, after all of that, what's the final verdict on these Bayesian networks? What should we really take away from all this?
It really all comes down to a trade-off. Yes, logistic regression wins on pure accuracy, but only by a whisker. And in exchange for that tiny dip in performance, the Bayesian network gives you this highly interpretable visual map. It handles messy data all by itself. And maybe, most importantly, it unlocks the ability to ask those powerful what-if causal questions.
You know, when you step back, it's about a totally different philosophy. It shifts the goal away from just creating a perfect but mysterious score and toward building a tool that provides genuine insight, one that a doctor can actually explore, question, and in the end, really understand.
And this all leaves us with one final big question to think about. When it comes to medicine, what's really more important? Having the absolute most accurate prediction, even if it comes out of a black box? Or having one that's almost as accurate, but is completely clear, explainable, and trustworthy?